Her official work hours have not yet started, but because our timing, just to give importance to the timing that we have, she has agreed to join us and conduct this program. A very small introduction about Kim Murray. She is a wonderfully talented lady. She is an RN and has a bachelor's degree in mathematical science and a master's degree in nursing clinical leadership. She loves teaching and has taught at prestigious nursing schools such as the University of Maryland and Johns Hopkins University. She has worked for the American Red Cross and was a nurse at the US Naval Academy. She brings a wide range of experience as a medical educator. This particular program is being sponsored mainly by the DISC Foundation and their Save a Life initiative to offer the participants free monthly lessons in CPR and safety to aid in your caregiving responsibility. A very small introduction about the DISC Foundation. The DISC Foundation was created for the sole purpose to empower others to save lives. Save a Life offers online courses to those seeking certification in various first aid programs and CPR and blood-borne pathogens certified by NHCPS. This organization puts the knowledge, skills, and ability to perform CPR and other proven techniques in the hands of people around the world. The best part is that once Kim finishes her presentation today, she will provide to all the students a unique code by which you can complete your online certificate also on CPR. It's completely free of cost, being provided by Save a Life organization. With this, I will hand over the program to Kim Murray. Kim, it's now your turn.
Well, thank you. Thank you for that nice introduction. It is 8 o'clock in the morning here, but the sun is up. So some people get up this early. I just tend to work later in the day. So we are going to be talking about some first aid topics and CPR for teenagers and adults. And then you can ask questions at the end, or you can type them in the chat if you want, and I'll get to them. So I'm going to share my screen and we'll start talking about some first aid. So there is my name. I am an RN, which is a nurse, and I teach math and nursing and CPR. And this webinar is presented by the DISC Foundation, which is part of our Save a Life initiative. And the sole purpose of the DISC Foundation is to empower others to save lives. So we are on a mission to teach CPR and first aid anywhere around the world, anybody that wants to learn about it. And we will also at the end here give you a free code. You can continue what you learned on our website and take the certified course for free. And so that will take a few hours to do on your own time. But when you're done, you can take the test, which is pretty easy. And then you can get a provider card. You can download that and print it out, and then you'll be certified for CPR, and that is good for 2 years. So these are the items that we are going to be reviewing. Some common things that would happen for teenagers and adults so that you can learn a little bit about what to do if any of these things happen. So the first one we're going to look at is an asthma attack. And asthma is a lung disease. And you might have a friend who has asthma, or you might have asthma. So generally, once people have asthma, since they get diagnosed pretty early, usually by age 5, they know what to do when they're your age. But you can help them if you're not familiar with it. And if they are having an asthma attack, that means they're just having trouble breathing right in that moment. Sometimes it can happen for no reason, but sometimes it's every time they run or exercise, or if you're around things that would bother your lungs, like smoke or some pollen, some grass, some hay, or something like that, something that you could be allergic to that would be getting up in the air. So if they're unable to breathe or have shortness of breath, gasping, wheezing, so breathing strangely with a sound to it, even that sounds like a whistle, or if they feel dizzy or their chest hurts, sometimes they will grab their chest and say, oh, it hurts to breathe, and getting worried about it also. So they should have inhalers to use that are prescribed by the doctor, and hopefully they have that around, or if you have it at school, if they sometimes will keep it in a separate place at the school nurse or school office, and you have to go get it. And then they can do 1 or 2 puffs with their inhaler, and that opens up their airway, and then they feel a lot better. So anaphylaxis is the next one we're going to look at. And this is a severe allergic reaction. So people can have anaphylaxis for all different reasons. It can be allergic to food. You might be allergic to peanuts. And then if you're around peanuts, you might not be able to breathe, or if you eat them by accident. Some people are allergic to seafood or shellfish or cow's milk, all kinds of things. So foods can cause things. Also, getting stung by a bee or a wasp or something in nature that you're allergic to. And sometimes we don't know why it's happening, but it's usually, something has to get into your body that you are allergic to. So what happens is you're so allergic to it, the hives, which are the allergy rash that you get, starts causing problems in your throat and starts to swell shut. We're going to look at this picture. This is showing you that anaphylaxis can be all over your body. You can have trouble breathing, and your throat can swell. With the circulation, you can have dizziness and faint. On your skin, you can have hives and itching and swelling. And let's see, brain, they say anxiety, sense of doom, face, all the swelling, stomach, you can have nausea, vomiting, diarrhea. So this can affect all the things, right? So that's why we are looking out for it, because it's just can cause problems everywhere. So what we do for anaphylaxis is give an EpiPen. So that is the medicine that this lady's holding in this picture, and it's epinephrine. And EpiPen is the name of, the pen that we have the medicine in. And so it's really easy to use because there is a needle in it. It is a shot that you have to put in your leg, but this will open up the airway and the throat and get the person breathing again. And so they're very important for someone who is severely allergic to something. So it's interesting to see how to do it if you've never had to do it, because again, you could be somewhere and maybe your friend has a severe allergy to peanuts, and they have an EpiPen, but they're not feeling that well. you know, you can help them get it out of their bag and get it ready to go. So we're gonna take a look at, oh, it's interesting. Okay, hold on. Part of the video, not the whole thing.
A life-threatening allergic reaction, anaphylaxis, is unpredictable. It could be mild 1 minute, then suddenly it's scary, like you can't even breathe scary.
Or your skin gets all itchy and breaks out into hives scary.
Or your throat starts to tickle and close scary. It's different for everybody.
Every reaction is different. A mild reaction one time can be life-threatening the next. So it's important to know your body, know when it starts to feel funny. It could be the warning signs of anaphylaxis.
So it's also important to know how to use one of these.
An EpiPen auto-injector.
EpiPen Junior for the emergency treatment of life-threatening allergic reactions, and for people who are at increased risk for these reactions. EpiPen and EpiPen Junior should only be used to help someone during an emergency.
Ready to show them how it's done?
Yeah.
EpiPen Junior along with the green label is for kids, like me.
An EpiPen for bigger people, like me.
First things first, you take it out of the tube.
Bye-bye.
So let me go back to that. So that was just a little short clip about that EpiPen. And now we're going to look at diabetes. So we can have type 1 diabetes can be diagnosed in childhood or as a teenager. So before you turn 18. And after that, if you would get diabetes, it would be type 2. So there's a type 1 that is genetic and it's with you since you were born. And then type 2 is something that you can get as an adult from things that you do, like not eating healthy or not exercising enough. So they're treated very similarly. We have to watch out for low sugar and high sugar in people that have diabetes, and they have to be very careful with what they eat. You know, counting their carbohydrates and making sure they have enough and not too much. And so they're always balancing the sugar and carbohydrates in their body, because diabetes is a disease where the pancreas is not working correctly and it's not regulating the sugar. So here you can see the picture. Someone's wearing a bracelet and says they're a diabetic. That can be important to wear a medical ID bracelet so that if they do pass out, which can happen frequently, you know, the people that are coming to help will know and look right away and see if they, you know, it'll say diabetes on their bracelet so people would know what the problem is. So you can have either very high sugar or very low sugar. But the interesting thing is the high sugar doesn't damage the body that much. We've seen people go high, and then we've seen people go really, really high and can still be walking around. But if it goes low, like if the numbers for sugar are supposed to be around 80 to 100, and then somebody gets sugar that is 70 or 60 or 40, that can be very, very dangerous. And people can even, you know, pass out and then even have a seizure or die from not having enough sugar. So this is a medical emergency when this happens. So if you know someone that has diabetes, you want to look out for these things. They're not going to feel well. They're going to feel off, and they can even tell you, oh, my sugar must be low. And if they have a glucometer, which is the little machine where you prick your finger and check a drop of blood, then they can tell you what the sugar number is. So if they have dizziness, headache, and cool, moist skin. They might look pale and, just do not feel well at all. Like they're not moving around, they're just sitting down. Then this could be the problem. So if we're able to check with the glucometer, we can. Ahead of time how they treat that, then that's wonderful. But if we don't know and we're not sure, we see if we can give them a little bit of sugar. And that's fine because they might not even have diabetes and they might not be having low sugar. But if I don't have diabetes and I'm not feeling well and you get me to drink a little bit of juice or have a little piece of candy, that doesn't hurt anything. So even if this isn't the situation, it's something that we can try and can be very helpful. So if they're able to drink something, we can give them apple juice or milk or soda or even a sports drink like Gatorade. We just have to make sure it's not any of these new kinds that are diet sodas or say zero, Coke Zero or something like that, because those don't have sugar in them. They have some sugar substitutes, but those don't have any carbohydrates, and that's what we need at this point. Also, we can do small pieces of candy like jelly beans or just little Skittles or M&Ms, just something little they can chew on. And then we even used a tube of frosting that you can buy in the store or sugar cubes. And so here they are showing, they are giving them raisins or tablets. So now let's look at how do we know if we are getting diabetes, because it can happen in middle school or high school, as a teenager. So these are the symptoms to look out for that you would need to go to a doctor. So this is always hungry and always thirsty. That's something that I will look out for if a parent says that to me, or frequent urination, or just the peeing part. So like if they're saying, oh my gosh, my child is just peeing every hour, and then they're drinking like so much water and they're always hungry, but you're not gaining weight, it's just kind of going right through you, and actually having weight loss. So that means you're just really burning some calories here, and that's a sign that we need to get to the doctor. So then for us adults, we have to watch out for pre-diabetes or diabetes itself. So this one is talking about type 2, where it's generally over age 40. It's more prevalent in males, but females definitely get it too. If you have a relative with type 2 diabetes, like if your dad has it or your mom has it, or they got it when they were older, like 50 or 60. If you have high blood pressure and if you're not physically active, so you're not walking around, you're not doing a sport or working out, you're at higher risk. So what we need to do is move your body and make healthy food choices. And if you do get a physical or a checkup every year at the doctor, there's a blood test they can do to check your sugar, and another blood test to check if you might be having pre-diabetes, which means you're heading in that direction, but you don't have it yet. There's still time to reverse that and turn it around by making healthy food choices and also starting to move your body. So coming up with exercises you like or activity you like. So here's a little clip about diabetes.
Hi, I'm Joan London. More than 84 million Americans are at risk of developing type 2 diabetes, and many do not realize that they have the power to prevent it, or at the very least, delay its onset. The National Diabetes Prevention Program teaches people with the condition known as prediabetes how to make simple lifestyle changes that can make all the difference.
Hi, my name is Georgine Barspel. I'm a registered nurse, personal trainer, and a lifestyle coach for the National Diabetes Prevention Program. So that's the natural process of your blood sugar and your A1C. I teach participants life skills to reduce the risk of type 2 diabetes. If you're at risk for type 2 diabetes, it is very important to increase your physical activity. Most people need to start slow. Get motivated by doing something you enjoy. Here are 5 simple steps to get moving. Number 5, exercise while you watch TV. You can do arm or leg lifts. Simple weights or canned goods can be used. Number 4, take the stairs. Start slow. It raises your heartbeat and builds muscle strength. It also works your lungs and waistline. Number 3, go outside. The world is your gym. Explore. Do things you enjoy. Discover a new park, play catch, bike. Spending time outside raises your levels of vitamin D and puts you in a better mood. Number 2, dance around your home. It is a great form of exercise and fun. You can burn 300 calories in just 30 minutes. Number 1, walk. Do it alone or with a friend, anywhere, anytime. It is the ideal low-impact exercise. 30 minutes a day makes a big difference. Along with better nutrition, these simple steps will help you reduce the risk of type 2 diabetes.
If you are at risk for type 2 diabetes, you can work with a dynamic lifestyle coach like Georgine at a National Diabetes
So next, we're going to look at heat exhaustion and heat stroke. These are conditions that happen very quickly to anybody if they're hot. So you could be in a hot temperature area. You know, it's interesting right now, I live in Maryland, which is a state right outside of Washington, D.C., where our capital is. And so we're pretty near the Atlantic Ocean. I'm about 2 hours away driving from the Atlantic Ocean. And normally it's very nice in the summer here, which is why we live here. You know, it's 70 or 80 degrees Fahrenheit, which, let me see, Celsius, that's like 21 Celsius to 26, 27. But recently it has been just a heat wave, and our temperatures have been 90 to 100, which is 32 to 37. I mean, it's been so hot. And so this is really a problem right now, where normally we go outside and play, or we go to a swimming pool, or the kids go to an outdoor camp while parents are at work. And we're just really not even going outside, because just even going outside, you can't even walk to the store anymore without just getting so overheated. And so heat exhaustion is like just really abnormal heat, really high humidity. That's our other problem here. We have a lot of grass, trees, forest area, so a lot of green space, and you know, just very humid, and being near the ocean. So normally we sweat when we walk, but if you either have one of these conditions, or you're just in this high heat, high humidity, and it's just not getting a break, like even if you go in the shade, it feels the same temperature. And then what happens is you just get heated up too much on the inside. You can't sweat properly, and just really causes problems. So our elderly are more at risk, our young children, and if you have obesity, or if you're sick, if you have a fever or dehydration, heart disease, or any of these other things here. That just means you would be more prone to it, more likely to have it. So let's see, what is it? If you start on the bottom of this picture, it can start with heat cramps. And so it gets worse as you go up the picture here. And that is, maybe you're even trying to work out or run in the heat, but you might get a muscle cramp or spasm, your leg or your side, and you can't do what you normally do because of the heat. It's just too hot and you can't sweat properly. So if that happens, that's when you take that sign and stop and get to a cool place and try to get inside somewhere with a fan or air conditioning and drink something cold, and that will help. And so what happens is if we ignore that, then we could head into heat exhaustion, which is the next part in the middle. And that's heavy sweating, but feeling cold and clammy skin. Your pulse is faster. People could start throwing up, get tired, dizzy, headache, and even pass out. So when this happens, if the person has been in the heat or exercising in the heat, even if other people aren't affected, that person could have one of those things on that list that just makes them more easily have this happen to them. We need to get that person to a cool place, make sure they're not wearing a lot of clothes like a sweatshirt, or, take their shoes off. And then when you have cold water, we can put the cold cloths on them and see if they can drink anything. If they can't drink, they're throwing up or they start passing out, that's at the more severe side. And then we're headed into heat stroke. And so you need to get to the emergency room or, to a physician. So what happens with heat stroke is it's very high body temperature, 103 for us. And let's see, in Celsius, that is 39.4. So normally our body is supposed to be 98.6, which is 37 degrees Fahrenheit. And you might have a low temperature, going up to 38 or whatever. But once we get, 39, 40 degrees Celsius, that is too high. So it's like getting a fever just from being outside in the heat and not being able to cool down, whether you're exercising or just trying to walk to the store. So at this point, we stop sweating. Our ability to sweat in this temperature is not working correctly. So, still headache, vomiting, dizzy, passing out. And so this is when we are having a medical emergency and we need to deal with this right away. At this point, the people can't drink. They're really, I would say, out of it, like they're confused. You might ask them where they are and they don't even know where they are anymore. Or they might not know their name if you ask them. We need to get this person right away into something cold. So when I work at sporting events, we have ice baths ready. We have just big tubs. So if people are trying to run a 5K and it's very hot out, even though they normally could run that much and they train for it, just because it's way hotter than it's supposed to be, especially lately, they sometimes can't make it to the finish line, or they make it to the finish line and then they collapse and pass out. So we put the people immediately into an ice bath. So you can put somebody in the shower with their clothes on. It doesn't matter. If they're hot, we just dump water on them. If you have a bucket of water, it doesn't matter, that it seems funny, So any lake or pool or ice bath, we just throw them in it. So this is an emergency and this person needs to get to the emergency room right away. So next, we're going to look at burns. And this isn't very pleasant, but hopefully you don't ever see this, but it's good to just learn about it. It's kind of interesting. So if you are lighter skinned and get sunburn, your skin will get red. And that's a 1st degree burn. So that's that picture with the one, we can say that's the back of our hand. And so I'm very light skinned. So if I don't put sunblock on, I can't be in the sun 15 minutes and I will just get red. And so it kind of depends on the darkness of your skin. If the darker you are, the more protected you are against the sun. And that's the way our melanin, which is the part that provides color, that's the way it's designed. So it's a good thing. So that if you live closer to the equator, you would have darker skin if you were born there and grew up there, and that will protect you against all the heat. So the countries that are farther away from the equator, if they were, born there and lived there their whole life, they would have the lighter skin and the paler skin. Of course, today with travel, people can be any mix of color. So you can have a lot of different genetics, through your family, if somebody is from another area. But the lighter you are, the more chance you would have to get the sunburn. So lighter skin, we use sunscreen all the time when we go out, put it on our face and in our hands. And this, we don't really need to treat sunburns. You might put a cream on it. Aloe vera is the picture there. We like to put aloe on it. But there's different creams that we can buy just if it hurts or feels dry, but it's not really a big deal. So that's called superficial. It's just on the top of our skin. The next type of burn is second degree, which is like that picture of a 2. And that means you get blisters on it. So there can be some fluid that pops, some clear fluid might come out, and that's more painful. So that's a sunburn that would blister and peel. Or if you touch something hot, you touch a hot stove, that can just give you a small blister right away. So we don't, with second degree, we call that partial thickness because you've burned some of the top of the skin off, the epidermis. So under the do column, you'll see, we want to run that under cold water, and we can put creams on it, and you just put a clean bandage on that, and then that will heal pretty well like that. We don't really need to see a doctor for that one either. So our third degree is the worst, and that is called full thickness, and that's our other, excuse me, my mouse likes to do what it wants sometimes. So that's that 3 and that 4 picture. So that would be, an accident that happened, an explosion, or you were even at a campfire, bonfire, and somebody falls into it and their whole arm goes in the fire. So that's, it's usually from some sort of disaster or accident that happens. So you really are going to be going to the ER right away with that. The skin will look white or black, charred, just like a piece of wood that had been in the fire. So it doesn't look good at all. And you might be able to see things under the skin, like muscle or bone that is exposed. It generally doesn't hurt as much as you think it would right away, because you've actually burned through the nerve endings. So that's third degree or full thickness. So we don't want to put ice on it. What you want to focus on is in our do column under the 1 and the 2. If you get a burn from something hot or touching, fire by accident, or even the sun, if we just have redness and it's a small area, you might have a blister or 2. We run it under cold water, put some bandages on it, and then you can use some creams or some home remedies. Anything else worse than that, you need to get to the doctor. So we're going to take a look at some bumps and bruises now. What I like to use is the word rice for anything that happens, anything that kids do, running around, playing sports. If you twist your ankle or you fall and your wrist hurts, something like that, as long as it looks okay, it doesn't look completely broken in half. We try to rest, and so that means if we've twisted our ankle, don't walk on that ankle. You can still go to school and do your things, but you want to keep your foot up. So what we'll do is put it on a chair while we're sitting at school. So that's elevation. Immobilize is meaning don't use it, but if it really hurts to use it, we will even wrap it up and get an ACE bandage or a splint or something, and just wrap that up and keep it tight, and don't use it for a few days until it feels better. And cold is for our ice packs. So we use rest, immobilize, cold, elevation. And EMS is our emergency medical system. So here in the United States, we call 911 on any phone, and that will get us the ambulance. So in your area, you would just need to know how you get an ambulance. Who do you call? So that's EMS. If we have a bone that is, sticking out the wrong way, twisted the wrong way, looks deformed, then we definitely need to go to the ER if somebody fell. For any cut that you get from anything, we just wash with soap and water, and we try to use an antibacterial soap if you have that, and just put on a clean bandage. For nosebleeds, I will have children sit straight up and lean forward. So if they're going to hold a paper towel on their face, and have them sit like over a trash can, meaning like they're sitting in a chair, and then we put the trash can on the ground in front of them. So any bleeding and mess can go into the trash can, and you can give them a box of tissues or towels to use. It should stop in a few minutes. We're going to call for more help if it's still bleeding after 15 minutes. And we can also pinch the nose. We don't need to pinch down here because that's not what's bleeding. It's bleeding up top through this artery that comes up through the front of your face. So I can pinch up top, or I can even push right here. And that's where the artery is that's going up into our nose. So I can even push here, and that will help stop the bleeding. So you can get a bag of ice and you can put it just on your whole nose and face, because then it'll cover this area. Or we can even put ice on the front and back of the neck to help cool those arteries that are kind of overactive. And nosebleeds can happen for a whole lot of reasons. Some people just get too dry, the weather's too dry, and then it's just too dry in the nose and it bleeds, or allergies, or you sneeze and maybe it can happen. So some people will get nosebleeds, some people will never get them, but it can just happen, because of the weather or allergies. But also if you get hit with a ball when you're playing, during football or something, you can definitely just cause it to start bleeding. So just watch and make sure that that bleeding stops a little bit. So if we have any bleeding that's more than a cut, we want to put on gloves if you have them to help this person. Put some sort of clean cloth or gauze or towel on that bleeding. And we're just going to hold that. We're going to apply pressure for 5 to 10 minutes, and it should stop. We want to resist that urge to look under there and peek under there and see what it's doing, because lifting up that cloth can just let it keep bleeding again. So we're not going to look through it, but if we're holding a cloth and the blood comes through to our fingers, that's how we know it's still bleeding. So we don't take that off. We're going to just put another one right on top of it. So we'll do this. And again, same, we use 15 minutes a lot. If our body should be able to, fix things within that time frame. And if it doesn't, that means we need to get to the hospital or call the ambulance. If it is very severe bleeding, which could be from a gunshot or a very bad accident where, somebody cut an artery with something, there can be squirting or like pulsing with the blood, like it could be shooting out. So if you know that, obviously there is a problem, we're not going to wait 15 minutes. We're just going to call for help right away. And you might even need to put a tourniquet on if you know how to do that and have something available like a belt. So next we're going to take a look at CPR. And CPR stands for cardiopulmonary resuscitation. And this is combining rescue breathing with chest compressions. We are literally pushing on that heart and pushing the blood by squeezing the heart, and there's already oxygen in the blood from breathing. So we're pushing that blood around and then we're pushing that oxygen around. And so that's the whole point of CPR, is we're going to circulate the blood for that person because something is wrong and their body's not doing it. And so the whole goal of that is to keep oxygen coming to the brain by getting this blood circulating around until we get the ambulance or get this person to the hospital. So we are let's stop here and take a look at a video about CPR. Okay.
Hey, are you okay?
After confirming that someone is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR.
He's unresponsive. Go
Ensure the person is on his back on a firm, flat surface such as the ground. Next, kneel beside him and place the heel of one hand in the center of his chest, with your other hand on top. Interlace your fingers and make sure they are up off the chest. Position your body so that your shoulders are directly over your hands. With this technique, you can use your body weight to help compress the chest. Now, give 30 chest compressions. Keeping your arms straight, push down at least 2 inches, then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. For a child, push down about 2 inches. And for a smaller child, you may only need to perform chest compressions with one hand. Next, give 2 rescue breaths. First, place a breathing barrier over the person's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a past neutral position. For a child, you'll only need to tilt the head to a slightly past neutral position. Pinch the nose shut, take a normal breath, and make a complete seal over the person's mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath.
1 and 2 and 3 and 4.
Continue giving sets of 30 chest compressions and 2 rescue breaths until you notice an obvious sign of life. An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch.
1 and 2 and 3 and 4 and 5 and 6.
You have performed 5 sets of CPR on a child. You are alone and need to call 911.
17, 18, 19, 20, 21, 22, 23, 24.
EMS personnel take over.
28, 29, 30.
You are alone and too tired to continue. Or the scene becomes unsafe.
1 and 2
Have the AED for safety.
So the steps for CPR is making sure the scene is safe. We're going to look around. That's very important. We don't want to become another victim. So If there was some sort of accident, car accident, or a tree fell down, or somebody fell off a ladder, we can't just run over and get into the mix without looking around and making sure that the scene is safe, everything is secure. We're not also going to fall or be, in traffic if this person's in the middle of the road. Next, we assess them for responsiveness. So that means checking to see if they are conscious or unconscious. So we're tapping really hard on the shoulders and saying, hey, are you okay? If they move around a little bit or open their eyes, then even if they're, really not sitting up and talking to you, that means they're responsive. You got some sort of response from them. If we are tapping them and there's no response, they just look asleep or dead, then we need to keep going and see if we have to do CPR. So we're going to, at this point, call for our ambulance or tell someone else to call. But if we have the cell phone, we can put it on speakerphone and just get help and then follow directions of what the operator is telling us. If we have an AED too nearby, you can tell that person to get that. Our adults are more prone to have a cardiac problem, which means they could be having a heart attack or something like that. So then the
சரி ஹாட்ஸ்பாட் அனுப்புறா நெட் எவ்வளவு இருக்குன்னு பார்த்து
So then we might need an AED if they're having a problem with their heart. If we're talking about a younger person, teenager, a child, the AED isn't as useful, then we might not need it. We don't know. Because the children don't usually have heart problems at this age unless they know they already have one, but they aren't likely to suddenly get a heart attack. So after we check and see if they are responsive, then we are going to see if they are breathing normally. So you get down close and you just look and see, do they look like they're sleeping or they are just still and you don't see anything? So we should be able to see something moving like their chest or their abdomen and, be looking around their mouth to see if air is coming out or see if you feel it. If there's breathing, we can just wait with them for until the ambulance comes and help them get to the hospital. But if they're not breathing, we need to do CPR before anyone else comes. And that's why we teach this, because we call people that are standing around bystanders. So that means we're just waiting by for the ambulance to come. So that's who we're trying to teach to jump in and not be afraid to do some CPR if you need to. So for teenagers and adults, we're going to do 30 chest compressions, and then we try to do 2 breaths. The breaths aren't as important if you don't have a breathing barrier or a mask. We don't want you to put your mouth on someone, especially with COVID-19. There's the very high chance that you would get a disease from someone or a virus. So we are not doing that anymore. We taught that 20 years ago, but it's just not appropriate anymore. So you'll see in the videos that people are using a breathing barrier or breathing masks, and that's something you can order on the internet and just kind of look it up and see what works for you. So if you have one at your school, we should keep a breathing mask in the first aid kit area, and then that way someone can run and bring it to you if you need it. So we're going to keep doing 30 compressions and 2 rescue breaths until one of these things happens. This AED shows up, or the ambulance or other help arrives, or we see signs of life, which are just moving around or vomiting or a seizure. The person is not going to sit up and start talking to you like we see on TV. It doesn't work that way. or the scene becomes unsafe, which means, you know, maybe you were outside and something had happened or fallen down and thought it was fine, and then now you see more things are becoming unstable, then we need to move right away out of that area and take the victim with you if you're able to. Or if you're too tired to continue, and that would be only if you didn't have help coming, if you were way out in the wilderness or the country somewhere and just weren't around any hospital or anything like that. So hopefully that doesn't happen. We're going to look at the parts of CPR next. So there's another video for that. And this says practice while you watch, because normally we would be teaching CPR in the classroom and be practicing on our mannequins. But we're not doing that really since the pandemic. We're just teaching online. So you can definitely just think about practicing, or you can actually, you know, try to do some chest compressions on your desk or on your lap, and just it's more helpful when you do try to practice on your own so that you're more used to how it goes if it does happen.
Okay, it's your turn to practice 5 cycles of chest compressions and rescue breaths. Begin by kneeling beside your mannequin with your gloves on and your breathing barrier nearby. Next, place your hands on the center of the mannequin's chest. Make sure your fingers are interlaced and off the mannequin's chest. Your shoulders are directly over your hands and your arms are straight. Count out loud and keep pace with the metronome while giving 30 compressions. Ready? Begin.
1, 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10, and 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 25, 26, 27, 28, 29, 30.
Good. Now place the breathing barrier and open the airway. Pinch the nose, make a seal, and give 2 rescue breaths. Immediately give another 30 chest compressions.
4, and 5, and 6,
Remember,
and 7,
compress at a rate of 100 to 120 compressions per minute, and a depth of at least 2 inches for an adult. For a child, compress at a depth of about 2 inches.
30.
Great job. Now, open the airway and give 2 rescue breaths. Now back to chest compressions.
1, and 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10, and 11, and 12, 13, 14, 15, 16.
Remember,
17, 18,
push hard
19,
and
20,
fast.
22, 23, 24, 25, 26, 27, 28, 29, 30.
You got this. Okay, 2 more rescue breaths. Keep going. Give
1,
another
and
set
2,
of
and
30
3, and
compressions
4,
and
and
2
5,
rescue
6,
breaths.
7, 8, and 9, and 10, and 11, and 12, 13.
Remember,
14,
allow
15,
the chest to
16,
return to its
17,
normal
18,
position
19,
after
20,
each compression.
22, 23, 24, 25, 26, 27, 28, 29, 30.
Last set of
2, and 3,
compressions.
and 4, and 5, and 6, and 7, and 8, and 9, and 10, and 11, and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26.
You're
27,
almost
28,
there.
29, 30.
Finish with 2 rescue breaths. Good. You can now take a rest.
All right, so take a look at the list one more time and see if you can remember the steps. Is the scene safe? Check for responsiveness. We're going to say, hey, are you okay? Call for help, or send someone. Say, you call for help. Check to see if they're breathing, and then start CPR. Start with chest compressions. For choking, we want to see if they are coughing. Can you hear them coughing? And can you hear any noise? Are they able to speak at all? Or is there any noise coming out of their throat, even a whistle? If they are able to continue to cough and you can hear noise, we just tell them to do that and encourage them, sit up or stand up, lean forward a little bit, just try to get that food out of your throat. If that doesn't work, then the person will continue coughing but not make any noise. So they might be like trying to cough, and this is the universal sign of choking, is kind of grabbing your throat. That's when we step in and intervene. And what we're going to do is abdominal thrusts. So the person can be sitting or standing, and we come around behind them, and it's like a big hug. We're putting one hand in a fist and wrapping the other hand around it, and then we're going to squeeze up and out and just try to help them get that out of their throat. So here's a short clip on the hand placement for that.
Let the choking victim know you're going to help them. Wrap your arms around the victim and make a fist with one hand and place it above the navel in the middle of the belly. Hold the fist with your other hand and press forcefully into the person's abdomen and up toward the chest. Continue performing abdominal thrusts until the obstruction is removed or the victim becomes unconscious. If the victim becomes unconscious, lower them to the ground and begin CPR.
So we are going to take a look at your website, our website now, and we actually have a code that's specific for your group. So I'm going to share with you how to do this. We're going to go to savealife.com, which is also hosted by NHCPS. So I'm going to put that in the chat box here. You can either do savealife.com or NHCPS, which stands for National Healthcare Provider Solutions. So they're the ones hosting the website, but it will get you there either way. And how this works is you only need to use an email address to sign in and make your account to take the course. And you're going to put the free code in, take the course, which is reading through the material and looking at the videos. And then there's a test at the end. And so you do need to pass the test, but you can log out, you can look things up. We want you to learn the material so that you pass the test. And once you pass the test, you'll be able to instantly download and print a provider card and certificate. So it'll have your name on it and say that you are CPR certified. So everyone is welcome to do that. What you need to do is find the CPR. So I'm clicking on CPR, and it just works on the regular CPR. Cart. And so right here, you'll find a spot that says apply coupon. And for you, let me put this in the chat. We're doing Bindu CPR. So BINDU CPR all together. So I just put that in the chat, no space. You can do capital letters. And once you put that in, it brings the cost down to 0, and then you can go through the course. For our teachers here, we have some other resources if you want to look through any of this stuff under free resources. And there is also a mobile app, and you can download this for free on your app store. So this will also have all of the material on it for all of the courses, and you can look through all of it if you're interested in this. And you can also look something up in an emergency or for first aid if you want to. And then we also have books that I've helped write, which is you can download CPR book, and that's like a 50-page color book with all of the information in it. So that's a good resource to keep at your school if you don't have one like that. So that's the end of the webinar. And are there any questions that I can answer for anybody? Okay, if not, then I will leave you and I hope you have a good evening.
Kim, I would like you to wait a few minutes. I think Shivangi will have the questions asked from the participants.
okay.
Yes, Shivangi.
Thank you, Kim, for your time and patience. I would now request the audience if they have any questions. They can ask Kim. Participants?
No questions.
Yeah, I would like to thank
Yes, ma'am, you
Shivangi.
can go ahead. Yeah.
Yeah, can I start?
Yes, ma'am. Yes, ma'am.
Yeah. Good evening, all. It's my privilege to acknowledge the contribution of Miss Kim Urai on conducting this webinar. We all had an opportunity to share your thoughts, and we shall implement all the techniques discussed whenever a situation comes for first aid. I thank the school management and Shivangi who gave the arrangements this informative session. And I also thank the students for the attending this workshop. I appreciate your involvement. Thank you so much. Thank you all.
I would now ask Dr. V. Bindu to speak a few words.
Was indeed an amazing session, so informative. I think my students must have been benefited by that. Only a few have joined, but I request Debashish Chakrabarti to share the recorded video so that I will share to all the classes, let them watch it. And thank you, Ms. Kim, for the informative session. It was really enriching. And thank you, special thanks to Bindu organization, Shivangi, and Debashish Chakrabarti, and all the students who have joined, and Subhashini for coordinating. It was a wonderful evening. But I have a question to Ms. Kim. Are all the courses paid ones, or is there any course free one?
Yes, they're normally paid where anyone can just look for it and pay for it and take it. But by watching this webinar, you get a free code that I put there, Bindu CPR. So now when you go in, if you put that code in the coupon area, it'll ask you if you have a code or a coupon. It brings the cost down to 0, and then the CPR is free to take the course.
Thank you. It's actually, the topic is actually relevant today because all of us are inside our homes, and if suddenly some emergency comes, we cannot rush to the hospitals too.
Right.
So this kind of CPR and first aid programs are, so beneficial for everyone. And I too feel that I should learn something more. If any emergency comes in my home, my family members, I should be able to help them a lot. So we want this kind of a program again, Debashish. It was really helpful, and so thankful to you once again.
Good.
Thank you, Bindu ma'am. Thank you, Subhashini ma'am. Thank you, Shivangi, and thank you, Kim, for spending almost an hour with us. Kim, personally, I'm just mentioning you. We are going to meet on 3rd and 10th again. It's fine? Okay. Thank you, Kim. You can take your leave. I will not keep you more with us. Thank you very much. Bye. I'll meet you soon.
Thank you. Thank you.
I will now continue the program. We have a few formalities to continue. I will take permission from Bindu ma'am, and if we can continue this thing. A small feedback form is being shared with all of us. Please fill it up because this is the main source of motivation for us. because without that, we also don't understand whether we are moving in the right direction or not. So please, we are sharing the link with everyone. Please fill up the form. It takes hardly 2 minutes to fill it up. It's being shared in the chat box. Also, your school poster is live now in Facebook. I would request students who have an access to the Facebook, they can go there and drop their messages directly right now, because after the program is over, we also know that people are not that much interested. They will move somewhere else. So I will request everyone to go to the link and drop your messages, motivational messages, so that Bindu gets an opportunity to know your thought and we can proceed forward. Bindu ma'am will share the link with you, how to get this video downloaded, so that
Yeah, definitely I will share to all my parents.
Sure, I'm trying to get this PPT also from Kim. If possible, I can share that also. That will be wonderful.
Yeah, PPT as well as the videos also.
Correct. It will take a bit of time, but definitely we'll share it. And one thing more, ma'am, the code that has been mentioned, it can be used by anyone, whoever is attending this program, to get this certificate for as a CPR expert. The code has been given in caps, Bindu CPR. If anyone wants to, they can just go to the website that has been mentioned by Kim and use this code to get this thing completely free of cost. Anyone can do it. Any teacher, any student can go for it and can get it done.
Debashish, could you be able to send everything as a message?
Yeah, sure, definitely.
So that I can forward to all the parents.
That will be done. No problem. Ma'am, I would ask Shubhashini ma'am or you, as you wish, to request your students to fill up the form at the earliest, so that we can end the meeting at the earliest. We have got only one response till now from the feedback
Do
form.
one thing, you sent to Subhashini. She will get it filled and then send it back.
Oh, that's wonderful.
Subhashini, please take it up. This feedback form is important for their organization.
Yes, ma'am.
And also the link to the Facebook link I have sent. If people can like it and share it in their pages, that will be more students will come to know such programs are happening, so that more people can save lives. Because just as Principal Ma'am has mentioned, that since we are living at homes only, and second reason is that because most of the families are getting nuclear families now. So learning CPR and such first aid things are a great help for us. With this, we will end the meeting today. I'll share the details with you, ma'am.
Thank you so much, Debashish.
Thank you. Thank you so much. Thank you, ma'am. Thank you, Shubhangi. We'll end the meeting.